I think what can get in the way of success is if the work's done in a tokenistic way, if it's done to fulfil somebody else's goals, and the somebody else I'm thinking of is the wider organisation. So the organisation wants to say it's doing work on patient experience, and the staff feel in some way compelled to do it. I think that really stops them being successful in a major way. I think that if the team doing the work aren't given the freedom to get on with it, and if they're not allowed the space to learn how to do it and how to do measurement and so on, I think that is damaging.
It is around teams really being proper teams, not pseudo teams, as the term would be. That if a team isn't meeting, doesn't have a clear aim, isn't trying things and reporting back to each other and monitoring progress, you don't get traction.
The biggest challenge, I think, is time and capacity and staff engagement. I think the NHS every year notches up more and more pressure of workload. So it's reserving that precious time to do this focused quality improvement is the biggest challenge, really.
I mean, for us, the key challenge was about working across an integrated care pathway. So effectively, we had to form a new team from the start. So we effectively took people from the acute hospital, from patient experience, from management, from community hospitals and into community services, and brought those people together and got them talking. So clearly for me, one of the key challenges was about how we pulled the new team together and how we made the team accessible for people who were probably an hour away.
What gets in the way of success commonly is a failure to develop a coherent project that can be done in a finite amount of time and built on and learned about. The second thing is the feeling that the team can solve the world's problems. They can't, they need to focus. And the third one is they need to stick to a coherent methodology with project management and measurement being at the heart of what they do. And the fourth preeminently important thing is it needs to be seen through the patient's eyes, and it needs to be done with the patient, not for them.
To maintain credibility with our staff, we needed to act on those changes, and that in itself took time. So that was, I guess, the key thing. The key challenge that I found was really just making time to do that, and for all of us, something that we thought was important that we didn't want to leave.